Hello, Dahlia. I'm really happy to see you here today.
Andrii, thank you so much for having me. I'm excited to be here.
Yep. Okay, so we're going to have a little conversation about genetics and your company and yourself. I hope you're comfortable with this idea. And let's start with the main points, what you are doing and how you ended up doing what you're doing, and a little bit about your company.
Sure. I am Dahlia Attia-King. I am the founder and CEO of a company called Panacea. And our entire mission at Panacea is to increase access and utilization of life-saving clinical genetic testing. The reason we do that is because today in healthcare, over 80% of people whose lives could essentially be saved or changed by a simple genetic test are not actually able to get tested. And the reasons for that, my team and I discovered is there's multiple reasons, to be honest with you, but the two core reasons for this inaccessibility is number one, limited coverage by insurance companies. Most insurance companies don't universally cover genetic testing for people. They only cover it for very specific people, and those people unfortunately have to either have a really bad history of certain diseases or they have to be very sick themselves. So prevention and genetic testing is not a thing really for insurance companies. And secondly, and probably one of the most heartbreaking barriers is that doctors themselves are not that well trained on how to utilize genetics in the standard care of their patients. And it's to no fault of their own, really. Genetics is kind of a novel field, and most medical schools do a very small amount of training on genetics and genetic testing. So those two barriers, insurance companies and sometimes physicians, are really sort of the main reasons why life-saving genetic testing is sort of not very widely used and accessible in healthcare. And so what we do is we change that. We overcome these barriers. We bypass insurance companies. We bypass community physicians. We have our own skilled physicians, and we contract with very specific laboratories. And we bring this life-saving testing directly to people, like a direct-to-consumer company would. We believe that that will really change the game on accessing genetic testing so more people can get in control of their health and save their lives.
Hmm. Can you elaborate on these use cases, especially kind of life-saving ones? What's the typical scenario where genetic testing might be paradigm changing for the people?
Sure. So studies are showing, especially one of the latest studies by Mayo Clinic, it was the largest cancer genetic study ever conducted. Every member of the study received a genetic test, no matter what their history was, no matter what kind of cancer they had. And what the study showed is that 1 in 8 individuals with cancer have a identifiable genetic link to that cancer.
Mhm.
Previous metrics were, I think, far less than that, between 1 and 3% of cancer patients. Now this is almost 13%, right? One in 8. So what that's telling us is that in theory, 1 in 8 cancers could be prevented, or at the very least caught very early, so that something can be done about the cancer, and hopefully the chances of surviving are higher. So in these instances, genetic testing is life-saving, because these individuals will be able to understand where their risks are, and they'll be able to better target their healthcare with their physicians, of course, and identify these issues before they become real problematic issues. So this is super, super powerful. And when you think about 1 in 8 people with cancer, what does that mean? How many people is that? Well, in the United States, almost 1 in 2 people will get cancer in their lifetime. Massive numbers. You're talking about half the population of a 300 plus million, right, population country. So 1 in 8 of, let's say half of that, 150 million people is, like I said, about 12%. So it's many millions. It's close to 20 million people whose lives could be changed or saved by a simple genetic test. It's not 10 people. It's not, 20 billion people, but it's millions of lives. It's a big deal, and it's a simple solution that is totally underutilized.
Um, I've thought about that for quite some time because genetic testing is on the rise in Europe, for example, and in my home country was pretty much the case, especially for other things like prenatal testing or birth planning and all this kind of stuff. But it's always a statistical thing. Like genetics is all about statistics. If somebody has a certain gene, it doesn't mean that it will manifest itself.
Yeah, so you're absolutely right. Genetic testing, especially for prevention, right? It's really a risk assessment, right? It is not something that is written in stone just because you have, a certain variation that it has been determined to be high risk doesn't necessarily mean you're going to develop a problem. And the reverse is true. You could also not have any identifiable genetic variations and then ultimately develop a problem. So, to your point, this is sort of a statistical analysis of how likely are you to develop this problem. The good news is that many of these genetic variations that can be identified through genetic testing have medically available interventions. And the reason why that's important is because you don't just receive a genetic test and say, oh, I have a higher risk for developing breast cancer. I just have to sit there and hope it doesn't happen. You actually are able to sit down with your physician and create a very special plan on how to, identify these issues, right? For example, with breast cancer, you could receive more frequent mammograms, or there's other types of testing that you can also implement, that the average woman doesn't implement because you are simply higher risk. And of course, in extreme cases, if your risk is determined to be extremely high, like with the BRCA gene, for example, then some women may consider a preventative mastectomy, which is a prophylactic surgery, essentially. Not every genetic variation requires such an extreme measure. But the good news is, again, that something can be done to reduce your risk for these issues. And not every genetic variation carries the same risk percentage, right? BRCA obviously has a very high percentage of developing breast cancer if you have a specific BRCA variation. And then there are other genes that do carry risk, but maybe not as high. So it really just depends on the genetic variation. And like I said, in a lot of cases, there's medical interventions that can help you reduce your risk.
I wonder if, let's say, if there is an issue with the statistical risk, it is significant. Is it? I don't know how works in the United States, for example. Maybe you can explain who's going to pay for this potential preventive measures, like even mammograms or whatever. Uh, is it covered by insurance in this case, where there is only risk but not the actual manifestation of anything?
Yeah, so that's a very good question. I think it's sort of a hot topic right now in the United States. And the reality is it's really a case by case scenario. I know there are a lot of women who do receive insurance coverage for those follow-up preventative measures that are required as a result of their genetic tests. There's a lot of men also, of course, that receive the same coverage. And then some people, depending on their insurance company and their insurance plan, are not able to get coverage for those preventative treatments or measures, right? That might be required. So it really is. Unfortunately, a case by case scenario. I know in a lot of ways, insurers are becoming much more aware of the benefits of genetic testing. And they are, not all of them, but a lot of them are doing a lot to expand their coverage, especially for their clients that are ultimately high risk. But there is no universal rule at this time that sort of forces insurers to cover all of the follow-up services that might be required. That is a drawback, absolutely.
So that's a room for improvements, but basically it's on the side of the healthcare system as a service rather than the scientific issue here.
Yes, absolutely.
Yeah, I understand. Well, it's let's come back to science. um, uh, I'd like to know if you somehow leverage the genetic testing for the therapeutic needs. Like, for example, there are clinical trials or maybe early drug discovery programs that might be benefit from the information that is collected during such testing. Do you somehow get involved in this kind of programs, collaborations, maybe?
Yeah, great question. So the data that comes off of genetic testing, especially comprehensive genetic testing, right? When you're looking at all of your genes or many genes, that data is super valuable. And it's valuable, just like you said, for the development of better pharmaceuticals, the development of better medical therapeutics. And so the idea, sure, is to utilize that data for that good. As a company, sorry, that made a loud noise on the mic. As a company, we believe that our users' data is not our data to use. It is their data. And so they get to decide if they want to donate their data to be utilized by pharmaceutical companies or, research facilities. And that is the stance we take on the utilization of that data. Only you can decide how your data is utilized. We cannot decide that. But in theory, if somebody does opt into, a medical research program or donating their data, of course, we will, gladly donate their data. That is not something we do today, Andrii, to be completely transparent, but it is in the pipeline. That is a program that we intend to launch eventually. But again, we will only use the data of users who are opting into that.
That's great to know. Uh, as a follow-up of this, what's the actual difference between your company, Panacea, and let's say well-established brands like 23andMe, these huge companies? What's the difference in terms of business model, maybe, or on an actual approach?
Yeah. So I think if there's one thing that your listeners take away from this entire conversation, I hope it's this, because this is a vital part of what makes Panacea so important. So there's two real major classes of genetic testing. And each class sort of utilizes a completely different technology. There is the very popular direct-to-consumer class of genetic testing, just like you said, 23andMe, Ancestry. And they're wonderful because they essentially made genetic testing, or a version of genetic testing, accessible to the average Joe, which is so wonderful. But they use a technology called microarray. And microarray tech essentially is like a search and find, right? So let's say let's give a real life example. Let's say you're looking for a very specific word in a document. You type that word in the search and find function, and that word gets highlighted wherever it appears in the document, right? Microarray tech is very similar to that. It's sort of a very targeted search and find for a specific genetic change. The bad news is that you don't find what you're not looking for. You only find what you're looking for. And so a lot can be missed in terms of genetic changes that could be important for your health. The second group or the second class of genetic testing is a class that uses a technology called next generation sequencing. And next generation sequencing is a deep and thorough analysis of your genes. A real world example would be me saying, Andrii, read me this book, but don't read me every word. Read me every letter of every word of every sentence of every paragraph in the book.
It's a lot to read.
It's a lot to read, and it will take you a lot of time, but you will essentially read this book in a way that you've never read it before. It's an extremely thorough analytical review of the book. That is comparable to next-gen sequencing. Next-gen sequencing is not just a search and find for one specific change. It is an analysis and a reading of every letter of our genetic alphabet. Now, the reason why that technology is so important, and usually the technology utilized in medicine, is because it is so thorough and it does not miss anything in theory, right? So what we do, what Panacea does, is we connect users and consumers with the laboratories and genetic tests that use next-gen sequencing. And next-gen sequencing is essentially the backbone of those clinical tests. So anybody that purchases a test from us and our partners is going to get clinical grade, extremely thorough genetic testing. This is the type of testing that doctors are ordering, right? If they are using genetic testing in the care of their patients. By law, this test has to be overseen by a physician because it is a clinical test. That's why we work with physicians, and we have a team of physicians that review these orders. So this is not a, generic direct to consumer test that you buy that kind of tells you what % Italian you are, or, if you have a genetic aversion to cilantro. This is a test that identifies what kind of disease risks you may have inherited from mom and dad. And so this test could save your life. In if anything, it could at least, change your life or improve your life. That's really the core difference of what we do. Our business model is actually very similar to 23andMe. We bring genetic testing directly to a consumer. We bypass the barriers that exist in the space. You don't need insurance to use our testing. You don't need your doctor to order your testing. We sort of handle all that for you, and we bring these tests directly to people and make them accessible. But the tests we're bringing in, the technology we're bringing in, the value, the life-saving value of the testing we're bringing is very different than 23andMe and the like.
Mm-hmm. So it seems like your business model revolves around the idea of building this kind of infrastructure for the patients, for the doctors, for everybody, and being in the center of that infrastructure, connecting the dots, and then probably advising the patient what to do next based on the results of their tests.
That's exactly right. We're kind of in the middle of really skilled CLIA-CAP certified genetic laboratories and skilled physicians who know how to order and interpret genetic testing, and the genetic counselors that are certified providers that can read and understand the results and explain the results to patients so that patients really understand what their results mean and what they can do with their results. We're the middleman. Think of, this is kind of a crude example, but think of Uber. Uber didn't invent cars. They didn't invent drivers. Right. They didn't even invent transportation, right? What they did was they brought together these disparate key stakeholders in a way that made them extremely accessible to the average person. And that's exactly what we do for medical grade clinical genetic testing.
So essentially, it's a good example of so-called utility economy, where essentially the business model is to optimize and make it suitable, useful, accessible on the scale.
That's exactly right. That's exactly right. Because this incredible technology existed well before Panacea, right? We didn't invent genetic testing. We didn't invent next-gen sequencing, but we realized how inaccessible it was and how expensive actually it was. That's part of the barrier also. And so when we partner with our labs and our doctors and our genetic counselors, we negotiate pricing, and we make that pricing low enough to be accessible by most people. Granted, it's still expensive, but our goal is to really etch down that price so that it becomes truly accessible by more and more people.
Mm-hmm. You mentioned a lot about cancer, risk management, all this kind of stuff, but I assume there are many other areas where genetic testing might be very useful and maybe even more useful.
Yeah, absolutely. So we talk about cancer a lot because cancer is the second biggest killer of people in the United States. And science has reached a point of understanding genetics enough to sort of identify where some of these genetic changes might impact cancer, right? But it's not, to your point, it's not the only area. A lot of cardiovascular conditions can also be identified through genetic testing. I think cholesterol may sit under that cardiovascular category, and also neurological disorders. There's a lot of neurological disorders. There's a good amount of research to show that there are some genetic variations that can put somebody at higher risk for something like Alzheimer's. And then, of course, there's the rare disease category, where these simple genetic changes can sort of not increase your risk, but actually cause an active problem. So in those areas, genetic testing for prevention can be very useful. But I want to be fully transparent as well. Genetic testing is only as advanced as our scientific understanding of genetics. And today, we actually know a lot less than we don't know. There's still so much that we need to sort of research and understand when it comes to how genetics are influencing our health. And the area that we really do understand pretty well today is the area of diseases caused by a change in one gene, monogenic changes. BRCA is a perfect example, right? Because a specific change in that one gene can really increase your risk of cancer. There's other diseases that we believe have genetic origins or genetic factors that might influence the development of disease, like diabetes, like autoimmune disorders. And those diseases are more complex diseases. And the theory is that those diseases are caused by changes in many genes. And the bottom line is we still don't fully understand how all of these changes in multiple genes are really interact to cause these diseases. So that's really the area of genetics that I think will develop over time. But the area that we understand pretty well today is the area of monogenic changes. And those categories I mentioned earlier, cancer and some cardiovascular conditions, neurological disorders, sort of fall under that arena of monogenic changes. And that's kind of where it's very useful today.
So I really liked your analogy about the book, reading the book letter by letter, word by word, and building on top of this analogy. I would say that based on what you just explained, that we can now pretty rapidly read the book, but then it's still to be understood what is written, what's the contents, who is the progenitor, what they do, etc., etc. So
that's exactly right. Mm-hmm. That's a great way to describe it. So you can say, maybe we understand chapter 1, 2, and 3 really well, right? But chapter 14 and 15, although we read it, we still don't fully understand it. Maybe it's in a different language. Maybe it's cryptic. There's a lot of things that are not very clear. But yes, that's a spot on example. We can read it. We just don't fully know what it means yet. That's right.
Yeah, but we have seen a lot of progress lately in many areas. So I'm hopeful and cautiously optimistic about that, so to speak.
Same here.
Yeah. I have another question. It's actually about longevity. I'm not sure what you think about that area. It's a growing trend in the formal pharmaceutical industry, so to speak, but other people do not quite believe it's a real thing, other than just eat healthy, sleep well, and do some exercise, etc., etc. Maybe you can comment your opinion about how genetics can be useful here. Obviously, like, one thing is to manage the risk of something very terrible like cancer. That's obvious. But maybe there are strategies like in longevity clinics. I've heard there are some in San Diego or some other areas in the United States, which specifically try to analyze everything, assess every possible risk, and then build some strategies, diet adjustments, even, all this kind of stuff. First of all, do you somehow see your company growing in that area? And just your personal opinion. I'm just curious. What do you think?
Yeah, so I've talked about this many times with our geneticist and scientific advisor, and his name is Dr. Hinko Gierman. By the way, if anybody's interested, he's a lovely, lovely person and very, 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 very knowledgeable. The bottom line is that there really is, at least at this time, I believe there really is no holy grail solution to longevity. And I think the best shot that any of us have at true longevity is creating a toolkit with multiple different strategies, and group together, those strategies might give us the best shot at a longer, healthier life. A lot of people ask me, do you think genetic testing, is the holy grail of, is it the secret? Is it the one thing that everyone should do? And nothing would benefit me more than saying, absolutely, it's the secret, it's the holy grail, it's what everyone does. But the bottom line is, there is no one holy grail. We have to do multiple things together. And genetic testing is one of the things that we should be doing. There really is something to be said about prevention, right, as a strategy for longevity, because the likelihood of you surviving something as awful as cancer or a severe cardiovascular condition is by really preventing it, right? Not necessarily even catching it early or treating it early. If you could prevent it, that would be really the ideal scenario. And so when you talk about prevention, you talk about things like genetic testing, so you can identify where your risks are and hopefully prevent a problem. You talk about consistent exercise, right? Getting your heart in shape, getting your body in shape, building muscle, and all the other benefits that, of course, exercise has. You talk about a healthy, moderate diet, right? You talk about lowering your stress levels. You talk about creating a healthy social environment for yourself. All of these things are tools that, really need to be added to your toolkit. And so to answer your question in a very sort of long-winded way, I really don't think that there is one, secret to longevity. I think it's going to require an intelligent and strategic use of multiple tools and multiple processes. And yes, genetic testing for prevention is part of that.
I think we should not talk about longevity any longer. You know why? Because you explain it so nicely and so shortly that you will leave all the longevity bloggers out of their, options for content.
Well, I hope I
Because
don't make anybody mad, but that's the bottom line.
yeah, because that's basically what I think about that. Being pretty skilled in molecular biology and chemistry and all these kind of things. That's pretty, at least for the majority of people with the current financial situations. Pretty much that is it. Exercise, sleep well, stress management, diet, and all this, and socializing. That's pretty much it.
Absolutely. And again, using the tools that are available to you in science and medicine today, like, the preventative genetic testing, like maybe even some people would opt into doing the, I'm sure you've heard about it, the preventative MRI screenings, right? With companies like like Prenuvo. Some people, lives have been saved by that. So it depends on what you want to do as far as utilizing some of these tools available to you. But the bottom line is you have to do a lot of different things. It's not just one thing. And you have to be informed and sort of really understand what is scientifically valid and what isn't.
It's a very good point you're making, and I've heard it from other folks as well, that prevention is a new health care idea, and it will benefit massively the economy of the countries, making their people healthier for longer, and
Exactly.
and of course is better for people. It's always a good idea to prevent something rather than deal with that. And
Exactly.
I fully agree here. Uh, so with that, there is a nice kind of revelation for me. I've read an article several years back. The main point was basically that genetics is not your destiny, kind of. So the idea that, okay, you might have risks, might be some some issues with the genetics that you've got from mom and dad. But then at the end of the day, it's also epigenome that is massively important. And by making certain choices in life, better choices rather than bad choices, you can basically modulate your body, modulate your destiny in a way.
100%. Yes, I'm a firm believer in the same thing. Genetics are half at best of your health, right? And they what they carry, the code that they carry, is not really written in stone, so to speak, right? And you can do certain things that will optimize your genetics, right? In theory. And that's why it's important to understand what is written in your genes so that you can better target all the other behaviors that are vital to your health, right? And it shouldn't be a scary thing. A lot of people tell me, well, Dahlia, I'm scared to identify what's in my genes. But the bottom line is, this information is really useful to arm you and to help you better target your focus. And so it is not a scary thing, because it is not written in stone. It is not a death sentence. It is just information that helps you become more efficient and more optimized. And that's really how I think people should look at this, because you're just receiving more clues and more information to help you get in control of your health. Essentially, it is not your genetics are not necessarily your destiny, right? They are just clues on what could happen. And then it's up to you to kind of get in control of that, and hopefully do things that can help you stay healthy.
It's very encouraging, to be honest.
Well, I'm happy to hear that.
You mentioned, let's talk about practical things like we have talked about strategy, I would say healthcare strategy and things that nice to have. But for example, you mentioned whole exome sequencing, and what's the average cost of kind of comprehensive testing like this whole exome sequencing? Let's say how it's done, what's the results accuracy like, from the perspective of like usual guy like me. I want to use your services. I want to have tested, to get tested, and what's that for me?
Yeah. So whole exome sequencing today in the United States is really not commonly used for prevention. It's mostly used to diagnose a severe problem that has so far yielded no real answers.
Okay.
That's really the most common use for whole exome sequencing today. But it's so powerful for prevention. And that's kind of what we want to sort of introduce to the world, is whole exome sequencing should not just be reserved for very sick children or very sick adults. It really is something that can be utilized to prevent a lot of problems. And today in the United States, I just received the pricing a couple months ago of, I think, of the cost of whole exome sequencing in 2022. And the average whole exome test in the United States is about $9,000.
9,000.
So it's quite expensive and inaccessible to most people. And so what we wanted to do is change that. And we bring whole exome sequencing to our users with genetic counseling, which has its own expenses, by the way, with physician oversight, and an at-home kit that you can literally just swab your cheek with in a few seconds for less than $1,000. So it's a massive price difference, and we believe that part of the barrier to this test was the price, and that's why we're really doing everything we can to reduce the price. So to answer your question about, if you wanted a test, what do you do? What does this look like for you? You would simply go to our website. It is really that simple. You'd use a credit card or HSA or FSA if you have that in the United States with your insurance plan. And you purchase a test. You fill out a form and you will receive a kit from our lab partners within 7 to 10 business days. And you swab your cheek, you send that back to the laboratory, and they analyze your exome in 14 to 21 business days, which, by the way, is also unheard of because most exome and genome sequencing could take months. So 14 to 21 business days is very expedited. And then you'll receive your results from our team, and you can set up an appointment with one of our genetic counseling partners, and they will explain everything to you, no matter what shows up in your test, whether you have absolutely no genetic variations identified, or if you have a ton of genetic variations that are identified. You get a free session with a genetic counselor, because the genetic counselor is the expert that can really explain to you what your results mean and what you can do with your results. And so that entire experience, accessing the genetic test, doing it at home, getting a result, sitting down with a genetic counselor, all is made available through us. In traditional healthcare, it could take you months to identify a lab and convince your doctor that you want to test not only any test, but whole exome sequencing, and then convince your insurance company to pay for it, which is never going to happen with whole exome sequencing for prevention. And then you have to find a genetic counselor. I mean, this entire experience took me 6 months with my mother. I did it with my mother outside of Panacea. And it was torturous and expensive and confusing. And no one's going to do it. Basically, no one is going to do this. And that's why we decided to shift the paradigm completely and make all of these disparate, vital parts of genetic testing streamlined and completely accessible right on our site. It's super simple.
Wow. Well, first of all, I totally love the work that you're doing. That's, in my personal opinion, you are at the beginning of massive trend, in the industry and maybe the whole paradigm of the economy, healthcare economy. I am a big believer in the power of prevention, because, like, it's a no-brainer to so to speak. So with that, I'd like to wish you, first of all the best, that the company is growing, and you
Thank
see more
you.
partnerships this year and the upcoming years. And thank you for this very nice explanation. And yep, and have a great day.
Thank you so much, Andrii, for your time. And I'm honored to be able to be on your show and to hopefully educate and inform all of your listeners a little bit more about genetic testing and what Panacea does.
Thank you very much.